Now, it's often been said that you are as fit as your arteries. If your arteries are in good condition, then probably you are as well. And that's largely true unless you've got cancer, because arterial disease and malignant disease are the main causes of death in the United Kingdom, and indeed in many countries of the world. Specifically, arterial disease of the arteries, is the UK biggest single killer. It's the biggest cause of death, of mortality in the United Kingdom, and true for many other Western countries as well, and increasingly true for many developing countries as well, unfortunately. There was 190,000 deaths, that's 1 in 3 deaths in the UK last year were caused by arterial disease. Now, arterial disease particularly causes ischemic heart disease and ischemic and occlusive cerebrovascular disease. The cerebrovascular disease is going to cause strokes, and the ischemic heart disease is going to cause just that, ischemic heart disease. Because the arteries are diseased and narrowed, the distal tissues, in this case the myocardium, becomes ischemic, because the atherosclerosis in ischemic heart disease is particularly affecting the coronary arteries. So we can say that coronary heart disease is the cause of ischemic heart disease. And coronary heart disease is the biggest single cause of death in the UK. So we said that 1 in 3 deaths were caused by arterial disease. 1 in 5 deaths are caused specifically by coronary heart disease of the coronary arteries causing ischemic heart disease. And coronary heart disease is accounting for 1 in 4 deaths in men under the age of 75. So 25% of our men who are dying under the age of 75 are dying of disease of their coronary arteries. And as well as causing a lot of death, this causes a lot of pain and suffering. So it causes mortality, and it also causes morbidity. The leading cause of mortality, the leading single cause of morbidity as well. A lot of people are suffering as a result of ischemic heart disease. And it's been estimated that cardiovascular disease costs the UK economy £30 billion a year. Ongoing conditions such as heart failure and angina represent ongoing morbidity as a result of the disease processes. In the UK at the moment we're conducting up to 80,000 PCI interventions. So 80,000 treatments for myocardial infarctions are being carried out by percutaneous coronary interventions. There's a huge amount of healthcare resources have to be devoted to this. But the good news is that although it is still the leading cause of death, the incidence of this is going down somewhat. So the public health measures that were being taken, the health education that's being taken, and the improved early intervention is actually reducing the mortality in the UK. So the direction is good, but it's still our single biggest healthcare problem. And one of the really sad things to see is that arterial disease and coronary heart disease is becoming more common in poorer countries, less developed countries that did not used to have such a problem. So in many Asian countries, in many African countries, arterial disease now is a significant cause of morbidity and mortality. And a lot of this can be attributed to the fact that these countries are adopting aspects of Western lifestyle, such as smoking cigarettes, such as reduced amounts of exercise, such as high fat, high salt diets. So even though the problem is getting somewhat less in the UK, it's becoming a greater problem in many developing countries. So this is something that all healthcare professionals need to have a feeling for. You need to get some kind of handle on this. And we're going to start off by looking at the etiology. That is, what is it that causes the atherosclerosis in the coronary arteries in the first place?